Welcome back to another episode of Wellness Collaborative. I'm Dustin Hawken, and today we have two very special guests, Dr. Matt Bradshaw and Dr. Hillary Rutledge. Matt and Hillary have been in the medical field for over 20 years, and they've opened a wonderful practice here in Wilmington called Wilmington Functional Medicine. Dr. Bradshaw, Dr. Rutledge, pleasure to have you.
Thank you.
That's great. Thanks for having us.
It's our pleasure to be here.
I think to start, our viewers would love just to hear more about your stories, how you got into the medical field, and the inspirations for Wilmington Functional Medicine.
I will tell you the only reason I'm really in functional medicine is because of my wife. We were in school together. We actually met in school. And I had really bad constipation. Like I could not go to the bathroom. I was getting sick to the point of I couldn't eat. And she said, you should try like changing your diet a little bit, but moreover, take these couple of supplements. Boom, fixed it. So that really started to open my eyes. We were in chiropractic college at the time to maybe there's some things to this supplement thing, nutrition thing. And then later on, I started to develop, similar due to gut issues, some panic attacks. And she started asking me about, a little more specifically, my diet, maybe some potential gut issues, cleared that up using functional medicine, which of course she went back to school for after we finished chiropractic school. And it was a life changer. I probably haven't had a panic attack in 15 years, something like that. It's been a while.
Talk about an inspiration. You have the
completely.
story, it fixed you, fixed other people.
Right.
Large circle as to how we're going to get into functional medicine. I was in nursing school, thought I was going to be a nurse. I was pretty committed to that. And my first or second semester of nursing school, I don't even remember now. My sister, my older sister, who was my idol, who was a nurse, died of gastrointestinal cancer. And so because medicine had failed her, and it had failed me, and it had failed my whole family, I just quit. I couldn't do it anymore. I couldn't continue. I couldn't see myself telling other people this was going to work when it hadn't worked for me. I just felt like I would be selling snake oil, kind of. And so I dropped out of school, and I was pretty broken for a while. It was a pretty big loss at a pretty young age. And I wandered around the world for a bit. And then I got into two really bad car accidents right next to each other, like 3 weeks apart, and ended up in a chiropractic office. And so I don't think I chose chiropractic. I'm pretty sure it chose me. And then within 6 months, I started chiropractic school. And I was really drawn to the fact that chiropractic would allow me to practice medicine, which I really wanted in the nursing part of it. I really wanted to serve. I really wanted to help people, but in a natural way that was going to be more aligned with my values since my perspective had been completely shifted. So in chiropractic school, I just learned a little bit more broad spectrum. We went to a school that had a lot of different options as far as how can you really affect your patients? Can you just do musculoskeletal? Can you do a little bit more than that? Do you want to focus on neurology? Do you want to focus on lifestyle, nutrition, et cetera? And so I studied a lot of applied kinesiology, which is a lot of lifestyle, a lot of supplemental issues, a lot of natural medicine, a lot of, well, nothing's going to get better if you don't sleep. 15 years into practice, I was like, well, chiropractic is good, and I like it, and it's been great, but I think that there's more. So I found a diplomate program through the American Chiropractic Association, and I went back to school and I got my diplomate from the American Board of Chiropractic Internists in Functional Medicine. And so that was not what I thought this was going to be. I thought this was going to be kind of like, I'll do that on the side as we retire. It'll be kind of like my side gig. Chiropractic is hard on the body, for sure. It's a pretty physical job. And so those car accidents coming back to haunt me a little bit through that, I was thinking I could do something a little less physical, but still really using my brain and kind of in a different way. Exercising some things that I hadn't already experienced in that way. And I love being a detective and figuring out a puzzle. So I did that, took the national boards again. Don't want to take any more national board exams ever. And started to do some functional medicine just on the side while I was still practicing chiropractic. And it took off. And it took off, and it surprised me and it surprised him. And we had no idea the need that there was going to be for that type of practice in Wilmington, North Carolina.
So with functional medicine growing like it has in Wilmington and starting your own business, Wilmington Functional Medicine, Tell me a little bit about that business. How long has it been around? What have you been seeing?
It's been around for 4 years. We have been in our current location for just over 2 years. It ended up growing so large that I quit seeing chiropractic patients as far as manually adjusting 2.5 years ago almost, and dedicated my time full time to functional medicine because
Wow.
I couldn't handle the capacity that was coming in while trying to manage both of those things at the same time.
And we had to move out, don't forget. So the space we had was too small, so we had to find a different building. We had to move into a whole separate building. It just exploded. It was crazy.
Why do you think the demand for functional medicine is so high?
2 things. One, there are people who are considered quote unquote medical failures, so to speak. In the medicine's eyes, traditional medicine's eyes, they don't get the results that they would hope for, and they just kind of throw up their hands like, we don't know. So those patients are looking for something. However, there are also people who are going for a condition, let's say, high blood pressure. And that medication is not working as well as they would hope. And they get on a certain dosage, and then over time that doesn't work as well. So they up the dosage, and they up the dosage more, and they up the dosage more. And eventually they add on a second medication. And eventually there are effects, they're called side effects, but they're really effects of these medications. And patients start to think, I'm not feeling well in maybe other areas of my life as a result of this. Or they just say, look, I'm concerned about taking this many medications, and they're looking for something else. So in doing so, they're looking for something that's hopefully non-medication related or non-medication based, more natural at the core. I think those are 2 of the biggest reasons. What are your thoughts on that?
Sure. I also think that there is a population of people, and I think that a lot of them tend to be younger who want to do things more naturally. I guess there's also one other piece of that puzzle, and that is people who are told really there's nothing wrong with them. They're not necessarily even medical failures. They just can't get anyone to listen. Like, I've been to the doctor 7 times. I've been to 4 different doctors. They keep saying this. They're running this. They're running the same test, and they keep saying it's normal. It's normal. It's normal. So we run a different test. We just approach it from the side instead of straight on, right? And so there's so many different ways that you can approach any single problem.
When people come to you, what are some things, some blind spots, if you will, that maybe they say, hey, something's wrong with me, but I've taken all these tests? What are some of the common things that you see day to day in your practice?
Hormonal dysregulation for men and women, gut infections and dysbiosis, and mitochondrial shutdown. You have to work so hard, Dustin, in this world, in this life, to avoid being poisoned. It starts all with the Industrial Revolution. It hasn't gotten any better. And just think about the things that you do every day to not be poisoned. You're specific about what you eat, about what you drink, about the air filters in your office, about what environment you put yourself in, and how you want to live, right? It's a lot of that kind of stuff, and not everyone has the know-how or the knowledge, the tools, any idea of how to go about that. And I will say there's also a lot of information in this space right now, and so it can be really confusing when people Google things. I love the curiosity, but it's not always super helpful. So if they're Googling something like, how can I improve my sleep, right? Well, they start taking maybe melatonin. Well, okay, it might be okay short term, but long term, you're going to get some melatonin bounce back effect, right? And I know that, maybe you don't know that,
No, I
right?
don't.
But it's not great to do that long term, right? And it's not necessarily, it's supposed to be short term. Nothing is supposed to be long term in that way. Why should we definitely have to take it long term? Maybe we could switch something else that would make that habit in your life more easy for you to follow, and you would be happier.
I think people have been somewhat trained by the traditional medicine model that if you have a gut problem, you go to see your GI doctor. But the GI doctor doesn't look at your heart, or doesn't look at your hormones, or doesn't look at your diet. They usually just look at your GI part. So the problem is people then come to the traditional doctor looking for a fix for something, and they're just getting like one specific system of the body looked at. It's a very kind of a myopic look, right?
Mm-hmm.
And so it's good to take a step back and realize that the systems of the body are all tied together. So people come to us, for example, with acne. They don't realize that it's not necessarily a skin problem. It can oftentimes be a gut problem or a hormone problem, but the dermatologist doesn't tell them that. So they just think that, well, I'll just take this cream or this potion on there, when in reality, the root cause of it has never been addressed. And that's where functional medicine can be helpful for these patients.
I know that a lot of people struggle with sleep, so I'd love to stay on this topic briefly. So the melatonin withdrawal.
Natural substances, even though they do work for some people, are very much like a drug in the fact that if you keep becoming dependent on them, you will have to take more and more and more, right? You're not just, if you don't do anything else besides take a pill to change something, then nothing is going to change except for the fact that you're going to have to take more pills. And so natural substances are not different than pharmaceuticals in that way. If you're looking for the easy way out, functional medicine is not it.
Mm-hmm.
It requires work, it requires commitment, and it requires lifestyle changes that go along with your commitment to actually changing and wanting what you want. So you really need to be committed to that process. And it's not overnight because pharmaceuticals are much stronger than natural substances. That being said, most pharmaceuticals are based on natural substances, but you can't copyright and you can't patent cat's claw because it exists in nature. So there's not a ton of money in it, so they don't go that way. Same thing with melatonin. If they change melatonin some way, then they can make it into a sleeping pill, right? As far as pharmaceuticals go. But if you get the bounce back from melatonin, you're going to end up sleeping worse, or you're going to end up sweating while you sleep, or you're going to have crazy dreams while you sleep. So there's going to be some sort of reckoning at some point if all you're doing is taking a natural substance instead of taking a pharmaceutical and not looking at the root cause.
You could take melatonin, which is great temporarily, and we use a lot of supplements in our office, but a good majority of them, 99% of them, patients are going to come off of those if we correct the root cause. Oftentimes in this case, somebody who doesn't sleep well, it could be that they have high stress or high cortisol going into nighttime sleep, and that keeps them awake. You got to address that stress issue. You've got to reduce that stress. And that can oftentimes be a lifestyle issue for people. Or sleep hygiene. They sleep with windows open or with noise in the background, or other things that can affect their sleep. We want to address those too, because ultimately, if that helps them sleep better, they don't need to take the melatonin. So we just look at these from a diet, lifestyle, and supplement perspective, not just supplements, but all three, because all three of them tie together.
Right, and we really develop treatment plans between us and our health coaches that are geared to meet the patient's wants and needs, not ours. So that's another big difference between functional medicine and allopathic medicine, is that an allopathic doctor is going to say, okay, take this for your strep throat, you're fine, let us know if you need anything. We want to check in with those patients. How are you doing? What type of progress are you making? Because their goals are what we're going after, not ours. The patient gets to determine how quickly they want to go somewhere and where it is they want to get to.
It's just a whole different way of doing medicine. You think about traditional medicine, you wait in the office and you may be there 15 minutes early, and then you wait till an hour after your appointment and you go in and you get your blood pressure and maybe you get weighed, and then you see the doctor for 5 minutes and then you're done, and you're never really heard. And so I can see why there's such a large demand for what you both are doing, because people just want to tell their story and want people to understand them and try to help them.
Some of that is insurance related to, you kind of touched on that a moment ago, but I just wanted to reiterate, we do not take insurance in our office. So that can be a challenge for some people, but that is the reason we do it, because insurance doesn't pay for our time. That's where doctors are trying to fit in more and more people in an hour so they can make the money the company needs to make, because insurance isn't going to pay them to spend that time. They get them paid to actually diagnose and prescribe the medication. That's what doctors are getting paid for. So our time is, and especially the patients and listening to them, is really valuable.
I have a lot of women patients who come in for different reasons. They want to get pregnant, they don't want to get pregnant. They want to be vegan, but also they know it's bad for their health and they want to change that, but they're not sure how to do it. And I would say that my average of people who come in and speak to me about that, and then I go over a multitude of tests with them. We usually run somewhere between 3 and 4 tests on folks. We layer them together and say, so here's what we found in your blood test. This is now supported by what we saw over here in your gut test. And then when you look at your cortisol test and you see how you feel during the day and you see what the relationship is, do you understand how all of these make sense? And it is tears, probably 7 times a week. You think 7?
Probably.
Average? I'm going to say 2 to 3 a day. I get crying because they, 1, have answers, 2, have been heard, and feel like they have agency now, and they're trying to understand. Like I have a whiteboard in my office and I'm drawing pictures. Here's how this works. Here's how this works. Here's why this is affecting this. Does that make sense? Like, and I'm checking in with them. Do you understand what I'm saying? Do you understand why these are all layered and we have to fix not just one of these items, but all of these items in order for you to actually get to where you want to go with what your goals are?
So speaking about spending more time with patients, talk to me a little about the process, start to finish, at Wilmington Functional Medicine.
She was mentioning earlier about these tests that we run. You know, most people have had blood work. It's pretty common. People go in for their annual checkups. Blood work gives you a lot of good information, but it is not the whole picture. So we have found, and this is not something that we have made up, this has been going on for years and years through doctors way ahead of us who have found that through research that stool tests can be very helpful, that urine analysis can be very helpful, that saliva testing can be very helpful. Looking at hair analysis can be helpful to give us a bigger picture of the whole spectrum of somebody's health. What is actually going on? A deep dive, essentially. And so when somebody comes into our office, we need to determine which tests we should run. So they'll sit down with our health coach, and we've got a great team of health coaches that work with us, and they'll sit down and they'll go through the entire health history on somebody, and that blows the person away. Like literally, we want to know, what was it like when you were a child? Did you have a bunch of antibiotics when you were a kid? Because that could have affected when you were 12 years old, you started to develop, OCD or anxiety issues. We want to know when they were 18 years old to 22 that they were on this type of birth control, which can really affect other things leading to hormonal imbalances down the road. And so we want to go through this. And so our health coach does that and then starts to then figure out on this health puzzle where we're going, and they come to us and we say, okay, we should run this test or this test or this test. And that's where at the second visit, they come back, they sit down with us. And as a doctor, we spend up to an hour and a half with these patients going through all the results and figuring out what is at the root. And then we tell them, this is how we're going to treat it from an all-natural perspective. Like I said earlier, diet, lifestyle, and nutrition in terms of supplementation.
Now they have this plan of action or how they're going to attack the problem. How often are they checking back in? Are they coming in routinely to give updates? How does all of that work?
Yeah, we have those visits usually followed up with our health coach, because oftentimes, and so many people think they come in and they say, my diet's pretty good, I eat pretty well. But once we start to really take a look under the hood, we're like, no, there's a reason you're here.
Yeah.
And so our health coaches are really, they're fantastic, and they are really our specialists in that regard. How to fix your diet, and there's all kinds of, parameters within that as far as how often you should eat, what you should be eating. Those follow-ups are really important because we only have so much time to see the patient. We really see them after they go through those steps with our health coach. Are they making the progress they should be, like we would be expecting? And we usually see the patient about every 60 to 90 days, depends, maybe a little more often if we need to, but it's usually every 2 to 3 weeks, especially initially when you're trying to get somebody on the right path. You got to keep them locked into what they should be doing, kind of guide them through that. And then once they get through those initial speed bumps of changing their lifestyle and diet, then they start to get on a roll. It makes it much easier for the patient to say, this is going great.
When you see someone, on average, just an estimation, how long does it take for them to see that change, and then they're, I guess, fixed with whatever issue, or is it something that they will have forever?
I think it's usually 6 to 12 months. So our goal is always to give patients agency in their health and to create a treatment plan that is going to give them long-term sustainable results. We want them not to come back to us in 3 months and say, I'm no better, or next year, and now I have the same thing again. What happened, right? Now, that it can happen, especially if people fall off their plan, right? But I want to say they decide where they want to go, right? We just tell them how to get there and how much guidance they need and how are they going to do it. Once they get there, we want to show them how to maintain that. We're giving them the tools, but it can be tough in the beginning, especially when you think you already eat really well, when you don't.
You say 6 to 12 months, but we do have patients where within 2 weeks, they're already feeling like something really is getting better quickly.
Wow.
Oh, yeah.
Those, like those miracle cases where they're like, I've been sick for 17 years with this problem, and they come to us and within a month, they're feeling 80% better. That does happen, especially if it's really just one big thing that nobody has really caught. And you hit that first month, they're like, you get tears again, right?
Yeah.
It's cool stuff.
Yeah, it's amazing. So the practice, 4 years old now, it's growing like crazy. You've been very successful at what you're doing. What's the vision of the practice, say over the next 3 to 5 years?
I think even more surprising than the number of people that have come to us have been the number of people outside of this area in other states who have come to us. So I think probably the first thing is we would lop off Wilmington off the name. It would be functional medicine of something else, right?
Yeah.
Whether it's, I don't know, well, just got a new name because Wilmington doesn't apply so much as we continue to grow. I would say that's the first thing I would say. This is as well a bit conducive to a virtual type of business in that, like I said, patients from out of state can see us. We can mail them the kits that they need to run. We can send them for blood work where they live, and we can see those results and then tell them what to do. And we can do all this virtually.
Right, we're already licensed in more than one state, and we just continue to
Work
build
on that.
on that
California next.
based on where it is we feel like we would want to spend our time.
When you have those miracle cases that we were just referring to, or somebody who's been trying to get pregnant for a decade who gets pregnant, it's hard not to want that to continue to grow. I think the harder part about what we're doing now is knowing when to stop. Where's the boundaries? Because we have passions for helping people. And once she went back to school and got really dialed in with functional medicine, and I started to see the change. Like, she comes home and she's much happier. I wouldn't say she was unhappy with chiropractic, but just more turned on, right? Like, listen to what happened with this patient today. That would happen rarely in patients in chiropractic, now happens almost daily with functional medicine. Check out this story. That is what excited me, and that is where we can see ourselves continue to make this grow.
So as we wrap up, what are some of the key things that you think that viewers need to know or should know or maybe haven't been told?
The other thing I want to mention that we all deal with is stress. When we're looking at how things develop in the body, cortisol, or this stress hormone, the fight or flight hormone, it really wreaks havoc on our immune system and our ability to protect ourselves versus infections. Whatever you can do to reduce stress, to bring your stress levels down, whatever that is. If you like to sew, if you like to read a book, if you need to meditate, whatever that is, do that at least a little bit every day. Find time. And it might be different on different days. Maybe one day it is meditation, one day it's surfing, one day it's golfing, whatever that is, find time, or even 5 minutes in a dark room, with no stimulation, and let your brain calm down, lets your immune system reboot, and lets your body reboot. That's a big deal.
So culturally, we're grinders. The capitalistic economy is such that it's a grinding type of economy. We're not taking 2-hour lunches, right? That's just not happening.
Or month
like
vacations
you do
in the summer,
in
like
Italy,
Europeans
or
do.
we're closed in August, all of August, right? It just doesn't happen here. And I resemble this because I didn't get to where I am in life by taking month-long vacations, right? But there's a grind in our culture and our society where if you want it, go get it, right? How long is it going to take you to get it? Keep working, keep working, keep working, keep grinding. And I'm a hard worker. I get that, but it is not good for your body long term. Our bodies are not meant to have the consistent amount of stress that we give them and demand over and over and over and over every single day. They're meant to be able to endure stress and then have it leave. Endure stress and then have it leave. And then we're relaxed again. So many people don't even digest their food because they're constantly in a sympathetic state of fight or flight, right? They're late for carpool, then they have soccer, and then they have 2 kids in band, and there's nothing for dinner. So all I could do is go to Chick-fil-A because they have to eat. But Chick-fil-A is not maybe really food, but it's kind of the best fast food. And they're talking and talking and talking, and they can't even hear themselves because they're trying to keep up with a literally untenable schedule in life.
Mm-hmm.
That is cultural here. Here's what my patient said this week after looking at their tests indicating how out of whack their cortisol is. I don't even feel stressed because it's so normal.
It's the normal thing.
We start that as adolescents. Well, you have to study in order to get into a good college. Well, what are you going to do with the rest of your life? Well, I'm 16. I mean, I think I'm going to go to the movies at this point, but what are you going to do? How do you want that to look? What's it going to be? It's a lot of pressure. And you start doing that at that age before you're even developed. We don't even realize how stressed out we are.
So someone who has some stress, maybe someone like me, so I do read every night. Is there other things that you would suggest to me to make sure if my cortisol levels were off?
I love the watching the sun go down and come up, not through a window, not through a screen every day, because it sets your natural circadian rhythm. The rods and cones in your eyes, they actually can see the twilight, right? And it tells you it's time to get up and go versus it's time to go down, right? And so you can actually train yourself, if you do that, even through the seasons with daylight savings time, to have a more reasonable circadian rhythm, therefore resetting your stress cycle and your cortisol awakening response.
Dr. Rutledge, Dr. Bradshaw, appreciate the time. Thank you for sharing your story, talking about Wilmington functional medicine. Will be known as something
We'll see.
functional medicine
We'll see.
potentially, but we appreciate the advice and giving us an insight to your business. For anyone who wants more information on Wilmington functional medicine, please visit Dr. Rutledge and Dr. Bradshaw's website at www.wilmingtonfunctionalmedicine.com. Thanks for your time. Look forward to seeing you soon on the next episode of Wellness Collaborative.